Hello, I'm Cecilia Frecha, postdoc scientist of the Allergic Diseases Research Group at the Regional University Hospital of Malaga in Spain, and I will talk to you about our latest work entitled LPS in combination with amoxicillin increases bat sensitivity to amoxicillin IgE-mediated hypersensitivity. Beta-lactams, and among them amoxicillin, are currently the most prescribed antibiotics, and their increased use is related to an increasing prevalence of drug hypersensitivity reactions that are mainly mediated and IgE-mediated. Basophil activation test that measures basophil activation upon blood incubation with a drug is a complementary in vitro test currently accepted for the detection of immediate reactions to beta-lactams. However, despite its high specificity, its sensitivity is far from optimal, and this can be explained in part by the small size of drugs that make them behave as aptans and or the need of other elements that, while present during the sensitization or acute phase of the reaction, are absent in the sample, which is taken at resolution phase. In the context of beta-lactam intake that occurs during an infection, pathogen-associated molecular patterns that interact with toll-like receptors and immune cells and stimulate pro-inflammatory cytokine production could contribute to beta-lactam-specific basophil degranulation. In this study, we evaluated whether the addition of TLR ligands to the bat together with amoxicillin could increase specific basophil degranulation and result in an increased bat sensitivity. 29 confirmed amoxicillin allergic patients and 20 tolerant exposed subjects were included. BAT was performed with or without pre-incubation with TLR agonist 1 to 8, followed by detection of CD63 and CD203C activation markers. From all the TLR ligands, LPS in combination with amoxicillin was the most potent basophil activation factor, increasing the percentage of CD63 positive cells, specifically in allergic patients, when compared to LPS and amoxicillin alone. In contrast to CD203C high positive cells that increased upon LPS stimulation alone in a non-specific fashion. Furthermore, to isolate the effect of amoxicillin in the context of LPS, we calculated the delta percentage of LPS plus AX parameter by subtracting the LPS-derived baseline activation to the LPS AX activation. Interestingly, delta LPS amoxicillin followed by percentage of CD63 detection allowed a significant discrimination between allergic patients and healthy controls. This strategy allowed to achieve 51% of sensitivity that was higher than the one achieved with the conventional BAT and maintained in specificity at 95% with a cutoff of 2.43, allowing to detect up to 47% of patients who would be otherwise reported as negative by conventional BAT based on CD63 detection. Furthermore, combining this strategy with the conventional BAT and CD203 detection, which were in fact the two most sensitive strategies of the study, allowed us to rescue up to 64.7% of the patients that were classified as negative by CD63-based conventional BAT. Noteworthy, we saw that the rescued patients were not the same among different BAT strategies, and the combined effects of LPS and AX were not homogeneous among clinical entities, patient backgrounds, or immune status, suggesting that LPS and AX could trigger different activation pathways in the complex landscape of allergic patients. Of course, more studies with a higher number of patients and in isolated basophils are required to elucidate the function of LPS and its activation pathways in these cells. But we conclude by this proof of concept study that LPS addition to the BAT could be a diagnostic-wise strategy for antibiotic allergy detection and points out differences between upregulation of activation markers in basophil response to pathogen receptor stimulation. Thank you very much for your interest.